Have you ever wondered about the prevalence of latent tuberculosis among healthcare workers, particularly nurses, in public health centers in Indonesia? It's a question that's been gaining ground due to an observable increase in incidence rates. The situation has reached a point where a deeper investigation into the factors contributing to this rise is not just warranted but crucial. This is where our study comes into play. Our objective? To identify the determinants of latent tuberculosis infection among the nursing staff working in these public health centers. By examining these factors, we can gain a clearer picture of the circumstances surrounding this increasing health concern. This could provide valuable insights into how best to manage and prevent the spread of this disease. So, let's dive in, shall we? Let's explore this pressing issue that's affecting the very individuals who work tirelessly to keep us healthy. Understanding these determinants could provide key insights into managing and preventing the spread of this disease. So, how was this study conducted, you ask? Well, it's a non-experimental cross-sectional study that included 98 dedicated nurses. The researchers collected data using validated questionnaires, asking questions related to factors that could potentially contribute to latent tuberculosis infection. But how did they confirm whether these nurses were infected or not? They used a medical test known as the interferon gamma release assay, or simply IGRA. This test is a reliable method to detect latent tuberculosis infection that doesn't show any symptoms. Now let's talk about the math. The researchers used logistic regression for statistical analysis. In simpler terms, this is a way to predict the outcome of a situation when the outcome is binary, like whether a nurse has a latent tuberculosis infection or not. A significance level of p(0.05) was used to ensure the results were not due to mere chance. By using these methods, researchers were able to accurately identify the determinants of latent tuberculosis infection. Now, you're probably wondering, what were the results of this study? Well, it was found that health facilities for tuberculosis transmission prevention were available in all public health centers. This is a crucial step in the fight against tuberculosis, but it doesn't end there. The study also pinpointed some key determinants of latent tuberculosis infection among nurses. These include occupational health and safety training, hand washing after contact with patients or specimens, and the wearing of medical masks. The odds ratios were staggering, with hand washing showing a particularly strong correlation. It's important to understand that these aren't just numbers on a page. They represent real-world implications for the health and safety of our nurses and the wider community. In conclusion, the availability of protective equipment and implementation of health protocols are the main determinants of latent tuberculosis infection among nurses. Therefore, these measures should be maintained by all nurses to prevent the spread of tuberculosis.